Have you ever wanted a longer penis? Well, you're not alone. In fact, in studies of thousands of men, 10, 20, 50,000 men, they found that anywhere from 45 to 55% of men want a longer penis. That's almost more than half. That's a lot of men. So if you're in a room with 10 men, anywhere between 4 and 5 of them want a longer penis. This is not an uncommon desire. I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast. This is your source for accurate evidence-based information about your sexual health and more. And in this episode, we're going to cover all the evidence-based ways to increase penile length, the risks, the benefits, what you should consider, and what you should probably not consider. I want to reassure you, if you are thinking about having a longer penis, very likely you have a normal sized penis. In fact, they've looked at this, they've investigated this information, and they've looked to see that the average man who's looking to increase penile length actually has a average or greater than average penile length. Now, what?
Pay attention, listen to her very carefully, because it's important. She's going to give you some information that could help you in your life and your experiences and your intimacies with women.
Range is anywhere from 3.5 to 6.5 inches. Now, that's for the majority of people. Of course, there are outliers who have longer penises, and there are men who have micro penises. Now, what exactly is a micro penis? So, a micro penis is about 2.95 inches or.
Wow. Micro penis? To be honest, I've never heard of that in my entire life. This is new to me.
Because I can see all of you guys getting out rulers and trying to measure, but these measurements are done in a very standardized way. Either they are done on erect penises or they are done on stretched length penises, meaning that the penis is extended as long as it can go, and you take a ruler and you measure from the pubic bone, which is the bone you feel, all the way to the tip of the penis. So not just actually the skin, you're actually indenting into the bone and measuring that whole length. It's important to realize also that length can change depending on how cold it is in the room, how comfortable you feel, how aroused you are if you're doing it erect. And so, it may be different one day from another, but on average, you will have a certain length that will remain about the same. And I've talked about this before on my YouTube channel, but there is a subset of men who suffer from small penis anxiety. And this is a real body dysmorphic disorder, meaning they perceive their penis to be very small and it causes them significant distress. And this is not to be undermined. This is a serious condition. It affects their daily life. They are constantly preoccupied with thoughts about their small penis. And this is really important to acknowledge because I think this is a serious mental health condition that affects their ability to function as normal adults. And this does not mean that if you are in this category, doing one of these things will immediately alleviate your anxiety. You need to address this with a mental health professional before going ahead and doing something to try and elongate your penis, because that may not cure the issue. It's important to deal with you as a whole human being, and your brain is a very powerful part of how you perceive yourself, whether it's your penis, your abs, anything you are concerned about, your biceps, whatever it is. A lot of it is dysmorphic, meaning that you have what's considered average or even above average, and it is bothering you that is not some idealized view of what you see or what you want to see. So now before
we continue, body dysmorphia is a serious mental illness. It can cause a person to do harm to themselves, like going and getting plastic surgery or BBLs or any kind of surgery that would improve their physical appearance. Body dysmorphia is a serious illness that can take some people down the wrong path, and some people have actually died on the surgery table. So if you're dealing with body dysmorphia, right, and you are in need of help and you don't think you're in need of help, body dysmorphia is a serious illness. Talk to someone. Please do. It could save your life. All right, let's continue.
into different techniques or devices that you can use to help increase penile length, I want to talk about the things you can do easily and for free at home. First and foremost is lose weight. If you are overweight or have gained some weight, you may look down and actually see this area of fat above the pubic area, which some people call the fupa. Now, this often, as this increases in size, will actually limit how much of the penis you are seeing. So the penis is not just what you see. The erectile tissue is two corpora, or two spongy bodies that go deep into the pelvis and turn downward and go into the perineum. And so that's why some people find stimulation of their perineum very pleasurable, because there's still erectile tissue there. And so if you gain weight in the pubic area, you are now covering the penis. You're actually not seeing that portion of the penis. So you may have said, like, hey, when I was 20, my penis looked great.
Yes, I've seen some people, male and female, that have fat that's hanging over their private areas. And I've wondered sometime, isn't that uncomfortable? So if there is a way that you can eliminate that fat that's hanging over through exercise, or go visit your doctor, talk to your doctor, you may be able to get some kind of advice or help. So be mindful of that fat that's hanging over. It could be a health risk, a health hazard for you, okay?
Great, and now it's shrunk like 2 or 3 centimeters. Well, yeah, you've probably gained a little bit of weight, and that is a difficult area to lose weight from. You need to work on losing your body fat, overall body fat. You can't just target that area and lose weight. But if you are able to lose weight through, healthy exercise with resistance training and cardiovascular training, and increasing protein and eating lots of fibrous, natural, healthy foods, unprocessed foods as much as possible, then you will see an improvement in penile length. The next easy thing is to actually trim or shave your pubic hair. Now, of course, you want to be safe when you're doing these things. You want to avoid shaving if you are a really poorly controlled diabetic. And the reason for this is if you get a cut in the area, it can very easily get infected and create a very devastating infection called Fournier's disease. Make sure you trim or shave that area if you can, and you will notice that your penis automatically looks a little bit bigger, because now you've taken that hair that's again covering the penis just like the fat was, and you're getting rid of it. And so now you can see more of the penis. The other thing you can do that's free is try to work on anxiety reduction. And that can be a variety of different things for you. That may be exercising, that may be meditating, that may be taking time for yourself, whatever that is. But you will notice that when you are relaxed, you will have better erections, or the smooth muscle in your penis will be able to relax more, allowing your penis to appear bigger. And so that's something that may help you, particularly if you are very anxious and have a lot of anxiety all the time. Working to improve that. Now, maybe at-home techniques are not going to work for you. Maybe you need to see a doctor to get some medication to reduce your anxiety, but certainly that may overall improve the appearance of your penis. And lastly, if you are having trouble with erections, check out all my content on improving erections. But the reason being, particularly if you're not having nighttime erections, we're worried that then you're not getting good blood flow to those tissues. And over time, you could develop scar tissue in those tissues, which then makes your penis shorter. So you want to have continued blood flow to those tissues at all times to prevent the scarring, which will ultimately shrink your penis. Those are the things that are free and don't require you to buy anything. They do require you to invest in yourself, invest in your health with diet, exercise, and stress reduction. Let's start with non-surgical means to increase penile length. Now, before I go on, I'm going to tell you no magic elixir or pill that people are trying to sell you online is going to elongate your penis. So don't fall for the traps. Don't spend your money on those things. Nothing is going to work. Now, some supplements I've talked about in a podcast before on supplements for erectile dysfunction do have some improvement in penile rigidity and erection quality, and that may, if you're getting better erections and you weren't getting them before, you may notice some degree of erectile length improvement, because when you're not getting erections, that tissue tends to scar down. And so potentially you might notice some benefit, but not just from a length perspective alone. Vacuum erection devices work because they have a cylinder that creates a negative pressure flow that then draws blood flow into the penis. Now, this will create an erection and increase penile size when you're using it. As you're using it, you then use a constriction band that is usually associated with the vacuum erection device to maintain the erection. Now, this is FDA approved for erectile dysfunction. The benefits are they're non-invasive. You can do it in the privacy of your own home, and it's likely not going to damage your tissues. There are studies that have looked at the ability to increase penile length with the use of vacuum erection devices. Now, the large majority of them have been done on two populations, one of which is if they've had a radical prostatectomy, meaning they've had a cancer surgery to remove their prostate, which affects the ability of those men to get erections and also affects the nerve function. So they're not having normal nerve function to the penis, which makes it more difficult for them to ultimately get erections. And the other category of men is men who had inflatable penile prosthesis and are trying to increase their length prior to that penile implant being placed. In both those groups, they have seen some modest benefit when using these regularly for 5 minutes twice a day to increase or at least maintain the penile length that they have. So in terms of the radical prostatectomy population, they've seen that men who use a vacuum erection device, they prevent length loss after that surgery. In men who've had an inflatable penile prosthesis or are going to have one, they've seen that it actually allows them to get a longer implant and have an easier surgery if they use the vacuum erection device before. In terms of healthy individuals, they have not seen an increase in penile length using it. Now, I've had people push back with me on this because they said, well, people are using it for 20 minutes a day, or there's animal studies that have shown increase in penile length. And yes, perhaps using it for longer periods of time or in animals, you will see an increase in penile length, but very likely you're going to see a modest improvement and it's not going to be long lasting. And at this point, I really can't tell you that there truly is, because there's no scientific evidence that using a vacuum erection device will create sustained improvements in penile length. Next, non-invasive option is penile extenders or traction devices. Now, these are devices that are placed on the penis. So usually they have a circular insertion point, and then they have an attachment that attaches to the glands of the penis, and then it creates tension or stretching of the penis for prolonged periods of time. And this is meant to be constant, gentle stretching. It shouldn't be extremely painful. It shouldn't be feeling like your penis is going to fall off. This is meant to be gentle traction over time. There's actually been several studies done on penile traction, and the early studies looked at using these for 4 to 6 hours a day for months at a time. And so it was a very long time commitment. They did see an average increase of about 1 to 2 centimeters in length. So I think when used appropriately, these can safely increase penile length, but they require a very motivated individual who's going to spend a considerable amount of time doing traction. Now, you can get bruising, you can get swelling, it can be a little bit uncomfortable at times. And so these are sort of the risks with it. In terms of newer data, so there's a new device that has come up called Restorex, and I'm not funded by them, but essentially they've done some really nice clinical data showing increases in penile length, specifically in men who've had prostatectomy or men who have diabetes and have had a shrinking of their penis over time due to likely lack of blood flow to the area from the diabetes. And they've seen about a centimeter increase in length when using it starting from about 30 minutes a day up to 60 minutes a day. And so not this 4 to 6 hours of routine, but a little shorter period of time, and they have seen improvements. So I tell people, if you're thinking about doing something for penile lengthening, this is a cost-effective, non-invasive option that you can try in the privacy of your own home. But realizing again that this is something that requires dedicated time and effort, and we don't know after you stop using the traction device, will the penis then shrink back to some degree. Next up is injectable fillers. Now, injectable fillers can come in a whole variety of different flavors. They can be silicone-based, they can be autologous fat transfers, they can be oil-based. Now, the only one that has reasonable safety data in my mind is hyaluronic acid. And typically, they're used more often for girth enhancement rather than length enhancement. They're not going to essentially increase length necessarily, but they may increase girth. Now, there have been studies that have shown some improvements with these fillers, particularly the hyaluronic acid fillers, but usually they require injecting smaller doses of hyaluronic acid than modeling manually, so trying to sort of get these in a good position and then adding more sequentially over time. When you add too much all at one time, you get more of a lumpy, bumpy result, which is not as desirable. Now, in general, these do have some risks. They have risks of bruising, swelling, nodule formation, and even asymmetry and pain associated with the injection itself. I do think at this point in time, we're starting to see more and more people offer hyaluronic acid fillers. I would love to see more data on this space. I still haven't seen a lot of the data on the newer techniques of girth enhancement, and I think it would...
The length that people will go to enhance men, the length that some men will go to enhance their penile erection, enhance the length of their penis. It's just crazy the amount of profit that these corporations are making out there. These corporations are making a killing. They are bathing in money because they are selling these different types of pills, enhancements, toys, all kind of things just to get us as men to buy them so we can have girth and length of our penis, right? But men, beware, because some of these are fraudulent and they could seriously harm you. So be very careful. And wives out there, please, if you see this video, advise your husband, your boyfriend, your fiance, your father, your brother, whomsoever is a male in your family, to seek advice from a medical specialist to make sure that they're not doing something harmful to themselves that could harm their families indirectly.
It'd be wonderful if all these people who are performing these procedures would actually show us true data of both good success stories, which we hear many of, as well as complications. But generally, I think if you're using hyaluronic acid fillers and you're using a reputable source that's using small amounts and trying to take their time to get you the best possible result, then you may see a benefit. But do know that fillers are short-lived. Generally, these last for 18 to 24 months because hyaluronic acid is a naturally occurring substance and our body will break it down. Now, it's really important to understand if you decide to get fillers, what is being injected. Some of these fillers have had devastating complications, upwards of 75% complications with very serious issues, either requiring surgery to get them removed or feeling disfigured or dysmorphic after having these fillers placed. So please do your research if you're going to get these done. They will not increase length, but they may improve girth when done appropriately. Before I move on to surgical techniques, I want to review the European Association guidelines on penile size abnormalities for men with body dysmorphia that were released in 2023. These guidelines are specifically for either men who have congenital shortness, they've acquired penile shortness because of a surgical procedure or some other issue, or they have body dysmorphia or essentially small penis anxiety. And so they looked at these techniques, both non-surgical and surgical, and put together guidelines based on the evidence available to them on how you should proceed. But I think we can apply the analysis to anyone looking to enhance penile length through any variety of means. Now, in terms of the things we've already discussed, they do mention penile traction devices, and they read specifically that overall penile traction therapy seems to be effective in lengthening the penis in both the flaccid and stretched state with minimal side effects. So in terms of vacuum erection device, they state one study that was done. Again, we don't have a lot of data on healthy young men, but this one study looked at men for 6 months and did not see a change in penile length after 6 months of use. And so they say basically data is sparse. We can't really make a recommendation. Now, what about hormones? You may wonder, can I use testosterone or HCG or FSH to increase penile length as an adult? And the answer is there is no data supporting the use of these medications causing any increase in penile length after puberty. And so likely the receptors are no longer sensitive to these hormones in terms of elongating penile length. Now let's talk about surgical options. Now, I generally don't recommend surgical options for increasing penile length at this time because complications are generally high, and this is your penis. And so I would hate for someone to go get something done to increase their penile length to only have a complication that makes them unhappy. So let's start with suspensory ligament incision. So this surgery essentially cuts a ligament that attaches the penis to the pubic bone. And this ligament, releasing this ligament, cutting a little piece of the ligament, allows the penis to hang longer. And so what that means is that it will appear longer in the flaccid state. However, because you've now cut that ligament, it may be a little less stable. So what this means is if it's less stable when you're trying to have intercourse, there is a little bit of a higher risk of injury. Also, after surgery, you would need to continually sort of stretch the penis to prevent reattachment of that ligament or scar tissue from forming between the two ends of the ligament that will then essentially do exactly what it was before, or maybe even make it appear a little shorter. And then there's also risk because that area is essentially very close to where the nerves to the penis are. They're at the dorsal aspect or the top aspect of the penis. And so this can then potentially risk changes in sensation, although rare. It can also risk penile deformity or potentially erectile dysfunction if those nerves are affected. Now, what is the result? In small studies, they've looked at this. They've seen an increase of about 1.4 centimeters in length, but when they looked at satisfaction, it was generally low. About a third of men were actually satisfied with the results of their surgery. Because again, 1.4 centimeters after undergoing a surgery and then having an unstable penis may not be very desirable. Next up is a penile silicone sleeve implant. This is an FDA cleared device that is used for cosmetic augmentation of the penis or correction of penile deformities. Now, it is basically inserted underneath the skin in a pocket underneath the skin of the penis to then allow the appearance of a longer and girthier penis. And it is cut to fit you specifically. So there's a relatively new study that came out this year in 2024 looking at outcomes. In this study, they had 299 men who underwent this implant between 2020 and 2022, and they looked at their outcomes. The good part about the study is they weren't just from one surgeon. They actually had 4 different surgeons who were all performing this surgery. On average, they saw really impressive increases, about 4.1 centimeter increase in length and a 3.4 centimeter increase in girth. But there were complications. Over 5% had flaring of the implant, meaning it was sort of flaring out, and so they required surgical revision. 5% had erosion, meaning they saw it actually come out of the skin and had to remove the implant. 2% had a seroma, which is fluid building up, and usually that's not a huge issue. 1.3% had infection, and when you have an infection with an implant, usually that means you have to remove the entire thing. Now, I will say these results sound really good, but as a urologist who speaks to other urologists and sees patients who've had this surgery, I will say when I see patients who have complications, they're not small complications. They are relatively life-changing complications for these patients, and so I would really take your time to consider the risks and benefits, because if a risk is 5%, but it happens to you, it happens to you. And so I tell patients this all the time, even before I see them for surgery, is I'm going to tell you these risks. They're relatively rare, but if it happens to you, it happened to you 100%. It didn't happen to you 5%. And so it's really important to think about those things before you have a major reconstructive surgery. But again, these are cosmetic surgeries. And so any cosmetic surgery, whether it's plastic surgery, penile lengthening, you have to really seriously consider the potential for risk. Next up, we have fat grafting or dermal grafts. These surgeries are essentially meant to increase girth. They're taking parts of your body, your dermis or your fat, to then attach to your penis and increase girth. This sounds great, right? Because we're not taking anything foreign, we're not putting an implant in, we're actually using your own tissues. However, the results have been relatively modest. They've seen at least a temporary increase in girth of somewhere around 2 to 3 centimeters. However, they see that that does decrease over the course of at least the first year, and they're seeing that that girth is maintained about 60 to 80% in the first year, but we don't know long-term effects. And of course, there are risks. There's risks that it could have an uneven distribution. You could still get infections. You can develop nodules from sutures or from your body's reaction to those tissues, even though that's less likely. And as I mentioned, some of this, your own tissue, may be reabsorbed by your body, meaning that the girth may not be maintained over the course of time. In terms of other surgical options, there are many that have been described in literature for very small subsets of patients. It has not been done in a large number of patients who are healthy, who are just seeking penile augmentation. So if you find a surgeon that tells you a surgery that you could get to increase penile length, ask them how many patients have they done it on, what is their complication rate, and have them list all the possible complications. And before you decide to go ahead with this surgery, also look up the surgery. See if you can find the studies yourself. You can Google things like on PubMed, which is essentially a Google search for people to look up articles, or go to scholar.google.com and type in the surgery you are considering to find if there are published data on this surgery. Now, in terms of other things that you can do if you are feeling like you're struggling with penile length, well, first and foremost, as I mentioned earlier, focus on your overall health, because as you get a better overall health, things will improve. So focus on getting a healthy, unprocessed diet, which includes a good amount of protein and fiber on a regular basis. Make sure to exercise 150 minutes of aerobic exercises a week, and that, if you are not active, can be as simple as going for walks. It does not need to be more intense than that at this point. Now, as you become more healthy and are used to doing 150 minutes of excess walking, then you can add on more cardiovascular exercise, which will be good for your heart, and include resistance training of at least 2 to 3 times a week, and trying to hit all your major muscle groups. Now, these are sort of basic things. Everyone should be doing them for their health, but if you're worried about your penis, there is reason to do these things because they will increase your penile length. As you lose weight, you will see more penile length. Now, I get it. Media makes a big deal about having a long penis. They joke about it, they talk about it, they make comments about it. It makes people feel really insecure. And just like women feel insecure about breast size or butt size or whatever, men feel insecure about penis size. This is a normal occurrence. As I mentioned very early on in the podcast, more than half of men are dissatisfied with their penile size, and their penile size is largely normal based on the data we have. So one is, what is making you concerned about your penile length? If you are with a partner, communicate with them about what they enjoy and what they don't. How can you make sure that you are both achieving pleasure? And as I've mentioned on this podcast many times and in my YouTube channel, is that the clitoris is the most common and reliable source for orgasm for women, which does not require a penis to be penetrating the vagina. That can be done with oral, manual, vibration, a whole host of stimulation that does not necessarily require penetration. And so you and your partner can have wonderful, amazing connections, pleasure, joy, and sexual encounters with a even under average penis. So it doesn't matter for the purposes of that. Now, yes, there are absolutely women who prefer a larger penis, likely because they do derive a significant amount of pleasure either from stimulation of the G erogenous zone, which is on the anterior wall of the vagina or the top of the vagina near the urethra, or the cervix. And in those women, you may need to get more creative. You may need to bring toys in the bedroom with you. And that doesn't mean that you're less of a man. That means that you are prioritizing your partner's pleasure, and that is unbelievably sexy.
So if you need to increase your penile girth or size or erection, and you are looking for ways, seek help, seek medical help. Don't just try some over the wall or over the counter remedies that could seriously cause harm to you.
Don't forget to like and subscribe.
On that note, remember to question everything, because if you don't, you may fall for anything. Think and say. Have a good day.